How does Botox block OAB nerve signals? Imagine a tiny messenger that tells your bladder to squeeze when it shouldn't. That's what happens in overactive bladder, or OAB. Botox can help by calming those signals down. Botox, which is a purified form of a natural toxin, works mainly by stopping the releases of a chemical called acetylcholine. This chemical is like a messenger that tells the bladder muscles to contract. When Botox is injected into the bladder wall, it blocks the nerves from releasing acetylcholine. Without this messenger, the bladder muscles don't squeeze involuntarily as much, which reduces the urgent feelings and frequent trips to the bathroom. But Botox doesn't just stop muscle contractions. It also influences the nerves that send sensory signals. These nerves tell your brain when the bladder is full or if there's pain. Botox decreases the releases of other chemicals like substance P and calcitonin gene-related peptide, which are involved in bladder sensation. This means it can lessen the feeling of urgency and discomfort, making the bladder feel less overactive. On a molecular level, Botox enters the nerve endings in the bladder and cleaves a protein called SNAP25. This protein is essential for the nerves to release neurotransmitters like acetylcholine and sensory neuropeptides. When SNAP25 is cut, the nerves can't send signals effectively. This dual action on both motor nerves that control muscle contractions and sensory nerves that send urgency signals helps improve bladder control. The effects of Botox are not permanent. Usually they last about 6 to 9 months. After that, the nerve endings grow back and the bladder's activity gradually returns. That's why many patients need repeat injections to keep symptoms at bay. In clinical practice, Botox is a second-line treatment for people who don't get enough relief from oral medications. It's given through a series of small injections directly into the bladder muscle, typically in an outpatient setting under local anesthesia. While generally safe, some people may experience urinary tract infections or difficulty emptying their bladder. In some cases, this might mean needing to use a catheter temporarily. It's important to note that Botox does not treat bladder cancer. Its action is focused on nerve signals and muscle activity related to overactive bladder symptoms. If you have bladder cancer, other treatments are necessary. In summary, Botox blocks nerve signals in the bladder by preventing the releases of chemicals that cause muscle squeezing and sensation. This reduces involuntary contractions and urgency feelings, helping people regain better bladder control. Always consult a healthcare professional to see if this treatment is right for you, and remember that individual responses can vary.